Okay, let's talk about a serious health risk that often goes completely unnoticed. You might not have even heard of it, but for some, it's a hidden ticking bomb.
It's called an abdominal aortic aneurysm. Basically, the main artery in your belly starts to bulge out.
The real danger here? If that bulge gets too big, it can burst, and that is a huge emergency.
The stakes are incredibly high. A rupture is fatal in about 90% of cases without immediate help.
So how does your body's strongest artery get so weak in the first place? Let's look.
Well, it's a combo of things: hardening, plaque, and losing the proteins that keep it strong.
What's really interesting is that these don't just pop up anywhere. They have a favorite spot.
Yep, about 95% of them happen right below the kidneys, where the aorta is just naturally weaker.
So this begs the question, who is most likely to get one of these?
Okay, the big ones are smoking, being over 65, and if it runs in your family. And it turns out men are 4 to 5 times more likely to develop an AAA than women are.
But here's the scariest part. There are almost never any symptoms. You just don't know it's there.
That means they're often found completely by accident. That's why screening is so important. The good news? Finding it is actually pretty simple. It's just a quick, painless ultrasound.
Okay, so if one is found, what's next? It's not about panic. It's all about making a plan.
For smaller ones, it's usually watchful waiting. Doctors just keep an eye on it with regular checks.
But once it hits about 5.5 centimeters, that's when surgery usually gets recommended.
And when it comes to surgery, there are 2 main paths: traditional open repair or a newer, less invasive option.
In one case, for a high-risk patient, doctors went with that less invasive route right through the groin.
They guide a special graft up to the spot, which then opens up, reinforcing the artery from the inside.
The result? The patient avoided major surgery and was home in just 2 days. Pretty amazing, right?
So what's the big takeaway here? How can you be proactive about all this?
It really comes down to this: quit smoking. That's number 1. Then manage your blood pressure.
So here's the final question. If you're at risk, have you asked your doctor about getting screened?